Hello, my name is Dr. Paul Allegra. I'm an orthopedic surgeon who specializes in sports medicine and hip arthroscopy. We're going to spend some time today talking about which patients meet indications for hip arthroscopy and a little bit about the perioperative course regarding hip arthroscopy. Hip arthroscopy involves minimally invasive surgery in the hip joint. When I'm talking about the hip joint, I'm talking about the ball, the femoral head, and the cup, which is the acetabulum, and the joint is the confluence of the two. Sometimes patients with hip pathology will experience pain with deep flexion and rotation as the ball starts to impact or impinge upon the cup. So the point of hip arthroscopy is sometimes to address that labral pathology inside and to shave away the impinging lesions either on the cup and the ball or just the cup or the ball. Additionally, hip arthroscopy can be performed to address soft tissue structures that aren't seen here, things like the abductor tendons that help lift our thigh away from our body, and the bursa sac here on the side of the thigh that can get irritated. When we think about arthroscopy in general, hip arthroscopy is newish in the last 20 to 30 years, so the indications are expanding. Labral tears, small cartilage lesions, impingement between the ball and the cup, or the femoral head and the acetabulum. Additionally, soft tissue pathology on the side of the hip, problems with the abductor tendons, or trochanteric bursitis can be treated with hip arthroscopy. Sometimes hip pain is not actually hip pain, it's coming from the back. Pain in the groin, pain deep in the hip socket. Sometimes patients will make a C sign over the side of their hip. That makes me think about ball and cup pain or femoral head and acetabulum pain. Whereas pain on the side of the hip, that can be pain along the greater trochanter or the soft tissue structures of the bursa on the side of the hip. Pain that's coming from the back and radiating down the leg is very often not the hip. Although sometimes back pain can radiate into the groin or the side of the thigh, and it can create a confusing picture. Usually when patients come to the office and they're being seen for potential hip pain, first step after history and physical examination is x-rays. Usually that's enough to diagnose some of the pathology. If there's impingement between the ball and the cup, we can see that oftentimes on x-ray. Usually the first step is conservative treatment consisting of anti-inflammatory medication, over-the-counter Tylenol, if there are no medical contraindications, in combination with physical therapy. Oftentimes I'll consider a hip injection be both diagnostic and therapeutic. If I put medicine directly into the area that hurts and you get better, it means that we're treating the right problem. But if we put medicine in the ball and the cup and you don't get relief, it means that maybe we have to look elsewhere, maybe the back, maybe the side of the hip, as a different source of the pain. Usually patients improve with conservative treatment, but if they don't, we're thinking about things like MRIs as a next step. When determining who is a good candidate for this procedure, the most important thing is that you meet with an orthopedic surgeon or a trained medical professional in order to review the indications and the pathology. But patients who do not have arthritis, who are younger in age, and do not have pre-existing hip pathology or dysplasia tend to do better than those who do. The benefits of this procedure are that it's minimally invasive, it involves a few small incisions, it's a same-day procedure, it's successful at eradicating pain and potentially mechanical symptoms. Just like any surgery, I always tell my patients there are risks involved with any surgery, no matter how big or small. Surgery to remove a mole or to fix your hip involves risks. It's important to talk with your physician in the office about these risks. For hip arthroscopy specifically, there's risks related to the type of traction we apply to the extremity. In order to perform the surgery, we have to distract the hip joint on a special bed. That can sometimes create traction-related problems that we can discuss in the office, but there are also general surgical risks like cosmetic deformity, scars, pain, but we'll review those in the office. Recovery after hip arthroscopy depends on the pathology that's treated, but most often you can expect surgery to be a same-day procedure and you can expect to start your recovery on crutches and a brace. Your weight bearing may be restricted depending on what is performed. I like to get my patients started in therapy within 2 to 3 days post-operatively. You're going to have restrictions that we'll review, and those protocols are dependent on what is treated at the time of surgery. Post-operative pain can be expected, but I like to encourage my patients, and I utilize a non-narcotic pain medication regimen in order to help make you comfortable. Ultimately, the purpose of hip arthroscopy is to get you back to doing what you want to do. I think patients who have failed conservative treatment that we've already mentioned, things like activity modification, anti-inflammatories, and injection in combination with physical therapy are excellent candidates for a hip arthroscopy, so long as they meet these indications. If you're experiencing hip pain and you think that you may be someone who would benefit from hip arthroscopy, be sure to schedule an appointment with one of our providers at Seaview Orthopaedics so that we can evaluate you and take the next steps in getting you back to doing exactly what you want to do.